Hi everyone, this is Dr Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi, welcome to the Equine Functional Posture Podcast. Today we are talking about the equine stifle, which I have actually done a few presentations on over the years at Equitana and different platforms. So it's a very important joint. How are you today, Soph?
I'm going very well. I'd like to share this little fun fact because I often get asked this actually during bodywork sessions. People are like, what's the equivalent of our knee? So the stifle is the equivalent of the human knee, which is a bit of a mind bender because their front leg knee is actually the equivalent of our wrist. So those carpals is, you'd find that in your wrist joint. Well, that's what we call them, the carpals, wrist. So that's the knee bones in the horse are also called the carpal. The front knee bones are also called the carpal bones. So yeah, that's a fun fact. They have their patella, which we're going to talk about. Theirs locks, ours doesn't. But yeah, so that's my little fun fact about the stifle.
Yeah, and over in when I was teaching in the Netherlands, they actually call the stifle the knee in the horse, and they were quite confused when we were calling the carpus in the knee because they're like, that doesn't even make sense. It's not equivalent. So yeah, some countries they do call the stifle the horse's knee, which is what it really should be.
Yeah.
So yeah, we see, I think there's been an increase in the diagnosis of stifle issues. Like we're becoming much more able to image it, and vets have probably more recently become aware of the large number of potential pathologies in the area. I mean, the most common one that people would be aware of is a locking stifle or upward fixation of the stifle, where the leg gets locked into extension, and it can be very distressing for the owner and the horse. But we also see a lot of challenges with the stifle because it can be very prone to twisting, twisting forces, and that can stretch or damage it. It's a very complex ligamentous joint, and we're going to talk about the anatomy of that. And, it's also influenced by the alignment of the hip and the pelvis, and the work that we're doing is going to kind of dictate the forces that go through that stifle.
Absolutely. And yeah, I mean, like you were just saying, there's functional issues, there's structural issues. Like just one example, you're talking about issues with the hip. Mini horses can be often prone to a locking stifle because just that they're prone to hip dysplasia and hip issues. So I think a big theme for us is going to be explaining how your alignment of your sacropelvic area and your hip is very influential over your stifle. And so you often see a roach back with stifle issues, and that's always a big indicator of posture. So yeah, it's a very integrated approach through the sacropelvic area and the horse's health through that space to support the stifle.
Yeah, and another little fun fact is like with racehorses that are racing in one direction, it's the outside stifle that comes under a lot of strain, because, and it's the same with circles, right? Like we can apply it to racehorses, but we can also apply it to the general alignment of horses on a circle. And majority of horses on a circle are not following correct limb alignment. So for example, the back legs are going underneath the body instead of following the front legs, and the horse is leaning in or they're leaning out. And we can say that's a product of natural asymmetry or laterality, but it puts a lot of strain specifically on that outside stifle on a circle, or in racehorses because you've got a lot of shear forces coming across the stifle, and yeah, and just a lack of alignment. So when your horse is doing a circle on the lunge, you want to really look at how the limbs are aligning and whether the hind hooves are following the front hooves or whether they're kind of going inside or outside of that. Because if they're going inside or outside, you also don't have spinal alignment. And you'll be able to see that because the horse's head and neck will not be flowing with the spine. So they might be always looking outside the circle, or you might notice their body is tilting in or out. And they won't be able to do a straight line. Like they'll struggle if you're on the lunge and then you offer them to do a straight line, they'll really struggle with that because they're not in alignment on the curve. So that's really important to look after stifles, is look at how horses are lunging. So the interesting thing about stifle anatomy is how many joints does it have?
3. So you have your femoropatellar joint, so the femur that's going from the hip to the stifle, and also has an interaction with the patella. So the patella is the kneecap also. Then you also have your tibiofemoral joint. So that's the bone that goes, that's the joint between the femur and the tibia. So the bone above and below the stifle, and there's 2 compartments in there. So it becomes a 3-joint complex. So there's 3 bones moving together in a very in a space with a lot of motion. So your patellar ligaments, the kneecap ligaments, you have one on the lateral, so the outside, the medial, down the middle, and also, medial, which is
Yeah.
on the inside, and then also the middle. So one going down the center, almost across the front aspect of the stifle, or just below the joint. So you also have your collateral ligaments, medial and lateral. So they're for stabilizing the stifle joint on the inside and the outside. So you imagine that it doesn't bow in or bow out, giving it lots of stability. You also have the cruciate ligaments, so the cranial and caudal cruciates. So what these do is they sit inside that femorotibial joint to stabilize the cranial and caudal motion. And what that means is it's kind of like they're in an X pattern. So one will stop the joint from destabilizing. So if you imagine the 2 bones are sitting together and you want them to stay together, not split off. So you don't want the top joint to pull backwards over the bottom bone, and you don't want the bottom bone to be unstable against the top one. So that crisscross pattern allows them to roll against one another, but not slide away and be unstable. You also, did you have a comment about those?
Yeah, I was just gonna say, like, the stifle is a very complex joint in terms of its ligamentous structure. And there's a lot of ligaments there external to the joint as well as internal to the joint, which can come under force. And I also just wanted to say that with the medial patellar ligament, that it has a fibrocartilage extension on it. And we're going to talk about the function of that in the locking mechanism, but just, kind of recognizing that.
Absolutely. And then, of course, you have your meniscus. So those are fibrocartilaginous pads in that femorotibial joint, and they are there for helping glide the joint. They absorb concussion. What other comments would you have about the meniscus and the stifle?
Yeah, and they have their own ligaments to stabilize them. They get very worn. I think it's rare under dissection that I've seen like a completely healthy meniscus just because of, you know, the amount of wear that goes through the stifle. And another little fun fact is there's only one other joint in the horse's body that has a meniscus. And, the menisci, as multiple for meniscus, are in joints that are highly movable. So the other really highly movable joint in the horse's body is the jaw, the temporomandibular joint. And so there's a meniscus in there because obviously they're chewing for 20 odd hours a day. So it's a very highly mobile joint in there as well.
That is very interesting. So would you have some comments then about the muscular attachment, the groups of muscles attaching into that patella and the role that they play?
Yeah, the quadriceps group attaches to the top of the patella and then it extends along the femur. It has a strong contact. They have a strong contact with the body of the femur. There's only one quadricep that goes up to the pelvis, which is rectus femoris. And we, posturally, there's a lot of horses with very weak and floppy quadriceps. And so if you see a horse with good quads, which is, filling in that front space between the hip and the stifle, just at the back of the belly there, then you can be much more confident that they have a better posture. Whereas if they're really floppy and lacking fullness, then you're going to have to work hard to improve that posture. So yeah, the quadriceps group. Lying over the top of that is the tensor fascia latae, which is a very fascial muscle, hence its name. It extends down into the fascia of so it comes from the tubercocci, so the pelvis, and then extends down the front and over the stifle. And then, when we're dissecting that, it's a continuation, the fascia all down the front of that leg. When the quads are weak, you'll often see, lines of the tensor fascia latae. You might see them when the leg's in extension. It depends, but that indicates that you don't have optimal function there. Sometimes it's a pelvic issue. That's if your tubercocci has had damage or doesn't function optimally, it's going to change the pull on that tensor fascia latae. The biceps femoris, which comes, it has an attachment at the sacrum and also an attachment into the pelvis, into the tuber ischia, so the point of buttock. Biceps fem is a pretty complex muscle because it crosses effectively the pelvis through coming from the sacrum and going to the pelvis, and also crosses the hip joint, the stifle, and the hock, attaches down to the hock. And so it has important functions in both flexion and extension and stabilization of the stifle. And so, for optimal stifle function, they will have nicely developed biceps, nicely developed glutes, and you can't have both of them being developed without nicely developed quads, nicely developed biceps, but you can't have both of them developed without having nicely developed glutes because it's going to be that balance, and then a balance with the hamstrings too. So and we do see damage with the biceps or just atrophy and weakness through that biceps with lack of pelvic function, lack of sacral function, or just inability to push appropriately through that hind end. And then there's a few other muscles that are not necessarily specifically involved in stifle motion, but are going to affect stifle stabilization. And if they're involved in hip motion, it's going to affect the stifle. So sartorius comes down onto the medial patellar ligament and has an attachment up into the lumbar area via the iliolumbar fascia, which goes over the psoas. And so that's how you can end up with a roach when that becomes quite tight and restricted. And the gracilis is also, comes around on the inner aspect of the stifle as well there, and it's the one that's in the kind of extends up to the join. The join, I don't even know what I'm saying there. The groin is a join. So
The join between the left and the right.
yeah. And on the pubis, but yeah, the groin. So, kind of considering the complexity of the stifle, how does it function?
Well, I mean, you've just described muscles, the quads, which are just behind the flank. You've talked about biceps, the hamstring coming, wrapping around behind the hip into the back of the stifle area. And then, you mentioned the glutes over the top of the bum, and then those muscles on the inside of the thigh and how they go up to the underside of basically where your lumbosacral joint is. So you kind of have a tension web in every direction, and they are going to be moving the joint through its range of motion. So you imagine that with those ligaments on the joint, so you've got one on the inside and outside, you've got your patellar ligaments, those cruciate ligaments, like Raquel was saying, it's quite a complex web of ligaments. They dictate that the stifle mainly has flexion and extension. So simply just closing and opening the joint in a straight direction aligned with the limb. And there's, of course, accessory motion that we were discussing just before that allows for a bit of shock absorption. And of course, the meniscus as well, that being there, that there's a lot of motion through that joint because the body has decided to place something that absorbs that kind of motion, it cushions and helps the glide in that space. So flexion and extension, some outward rotation, particularly because the stifle, when the leg comes forward, on the body when the horse is moving, the actual stifle moves outwards, the hip externally rotates, and it has to come out because it has to miss the belly. And so another interesting fact is that when you have horses with very big bellies, you block the stifle motion. So it's another part of changing the alignment of how your limb can travel forward. If it's got to move around big belly, you're going to have a change in the structure of of that area. There's also the reciprocal arrangement with the hock. So this means that this reciprocal apparatus means that the hock and the stifle, when you bend one, the other one bends as well. And so it's actually a very effective system. I've seen you in dissection, Raquel, when a lot of the tissue has been stripped away, all the muscles, etc. You still have that reciprocal apparatus. It's very strong. And when you cut through that peroneus tertius, which is one component of that stay apparatus, of the reciprocal apparatus, you can immediately flex the hock out behind, even when you're flexing the stifle. So the heart's
extend the hock out behind.
Yeah, so extend the hock out behind. And so it's very strange to look at because it's so unnatural. You get this kind of like, that's not meant to go like that. And interestingly, people were sharing at the latest dissection that it doesn't always, it's not always crazy painful for the horse either. When you're motioning it, or that they're not especially lame, but it's very destabilizing and it takes time to heal. And also you have your tendons in the lower limb. So this is really talking about the stay apparatus of the horse, its ability to stand securely and save energy by locking the stifle. And so you can imagine those superficial digital flexor muscles and tendon, as well as the deep digital, and you have your extensors down the front. So they're supporting that lower limb. So a little bit of tension through that space keeps the whole system upright, which is very impressive. And so you can really reduce the amount of muscular effort that the horse has to expend in keeping them upright. And that's why it's so easy for them to just sit on one leg and rest the other one. And of course, horses only lay down to sleep, between half an hour, and I have a horse who loves to sleep. So definitely 2 to 2.5 hours, Charlie's Beauty sleep. But that's a huge amount of time on your feet, up to 22 hours. So that system needs to be quite secure, and the stifle is a very important part of that.
Yeah, and it's also understanding, like when you talk about the flexors, like the superficial flexor crosses over the back of the stifle joint to attach onto the femur, and then the peroneus tertius is below the stifle joint, but it attaches right at the kind of right at the stifle joint along with those extensors. So the motion and I guess ability for those extensors and flexors to function optimally also is going to be impacted by the stifle alignment and function. And the hock is set up to allow for that slight outward rotation of the stifle as well, in its alignment, within there. And we see a lot of changes in the hock, which I would, say is from changes in alignment of the leg, and the stifle not functioning through its optimal alignment. And then because of that reciprocal arrangement, the hock is out of alignment, plus or minus hoof balance issues. So the stifle locking mechanism, which you mentioned, is part of the stay apparatus of the horse, which gives the horse its pretty unique ability of being able to spend long periods of time standing. It occurs because the medial patellar ligament can lock over, because of that fibrocartilage. It can lock over the medial femoral trochlear ridge, which is like a little notch, and the ligament kind of locks behind it. And then it means that, like you said, they can stand, rest the opposite back leg, so that's giving it a break, but stand on the weight-bearing leg with very minimal muscular energy requirement. So whenever we're standing up, like we're utilizing energy to stay standing, we don't have that locking mechanism. And like you'll notice with dogs, that if they want to rest, they spend 20 hours laying down,
Yes.
because they don't have an efficient method and they don't need it to stay standing all the time. So the mechanism within the horses reduces that muscular energy by over 90%. That's 97%. And so that reduces that effort of loading to 2 or 3%, like that's utilizing muscular energy, and that's just such a beneficial survival mechanism for the horse. So you want to see that your horse does rest, and that they rest both hind legs, and that they don't rest all the time, because that's also not a good thing. And I also had someone years ago say, oh, look, your horse is relaxed, they're resting a hind limb. And I'm like, but their whole face is telling me they're not relaxed. So if your horse also rests a limb in a stimulated situation, you've got to ask the question about what's going on there too, like whether that sympathetic tension through their body is creating restriction and discomfort, and so they're choosing to rest. Because in a stimulated situation, they should be ready to run, not rest. So that's one area that I'd look for abnormal resting. 2 is horses that don't rest their back legs, or you don't, see an even balance from side to side. And then 3 is that they rest all the time, especially if it's one leg. If it's both, I'm looking at the pelvis. Like if they keep swapping and changing, then I'm looking higher up. But especially if, there's an imbalance in they rest one leg more, then, I might be questioning the stifle locking mechanism of that leg, or the comfort of that leg. So yeah, that mechanism's super important, and the muscle function supports that mechanism. So if you have horses that are getting stuck and they're locking up where the leg's stuck out behind, there's a problem with potentially the activation of the muscles to help it unlock, or the angles have changed of the limb, which is usually also relating to like muscular balance and pelvic and hip function. So, but there's a lot of things to consider when we consider the stifle kind of structurally and I guess biomechanically. What are some of those aspects?
So definitely growth plate closure. So the growth plate of the tibia and the femur, you're looking at between 2.5 to 3.5 years in that area. Obviously, there are definitely horses out there that are working and doing quite a lot of activity through those ages. And so there is the potential that there's going to be, and it's going to have an influence on when those growth plates close. Sometimes work can speed that process up, but also just considering that the timeline of those things happening in the whole body, speeding it up somewhere could change the the angle of development through that space as well. If it's closing early, or if there's a huge amount of stress being placed through that area as well. There are definitely sports that ask a lot of the stifle, fast changes, rollbacks, concussive movements. You also, another consideration is going to be the alignment and glide of the patella. Sometimes, we've talked about locking, but often even, you can see sometimes horses that they don't lock their stifle, but the action of that patella flicking on and off the notch, so on and off of the stay of that locking patella mechanism isn't smooth. And so the quality of that just isn't there for them to have a very smooth transition, from halt into walk and also decelerating. They'll get this like clunky action where it just like clunk, it goes on. And so like considering the quality of that action, what else?
Yeah, the muscle balance. So just looking at that muscle balance will give you an idea of how that stifle is functioning.
Yeah.
And also, there's been studies looking at the myofascial lines, like the fascial connections throughout the body, and there are a number of myofascial lines that pass through the stifle. So, like the superficial ventral line, which goes along the abdomen, the functional line, which crosses and it kind of goes around the hock joint. So it goes through patellar ligaments, the lateral line, which goes along the side of the body, and the spiral line, which crosses the body 3 times. So if there's any restrictions within those lines, it can have an influence on how that stifle kind of functions, and its alignment. And I think you mentioned too about hock and hip alignment is going to signify, or hock and hip, yeah, alignment and function is going to have a significant effect on how that stifle functions. Yeah, so it's, and I think you also mentioned about like the growth plate closure and things. So I had a horse years ago and she was a yearling at the time and she was growing beautifully. She was really nicely put together. And then all of a sudden she roached in her lumbar and the owner's like, can you treat her? She's not right. And she would not let me near her stifles. Like, absolutely do not touch them. And I said, like, what happened? Like, something must have happened. And she's like, no, like, nothing happened. And we ended up getting him radiographed, I think it was a couple of months later because she was young, she hadn't really been on the float. And like the vet cleared her stifles, but what I noticed was that her growth plates were closing and she had spurs in them. And then what we figured out, shook us a while, was that the owner had put her in a different paddock with 1 or 2 other horses and they chased her, like really badly chased her. And so she was twisting and turning and panicking and trying to get out of the way. And I think it lasted a while before she could change the situation. And, we improved her roach, but at that time it was very difficult to get it to go back because the stifle had been permanently affected. Like I know she's being ridden now and she's being jumped. I haven't seen her for many years, but yeah, so that's, when we've got young horses and whether it happens in a paddock situation or it's the work that we're doing, especially under that time of growth plate closure, so under 3, if you're doing twisting, turning, fast motions, it's really not setting your horse up for longevity of their body and the hocks will be what cops it at the end of the day, if the stifles have come under a lot of twist.
Absolutely.
So
Talking about those diagnostics, a comment on radiographs from you.
yeah, I mean, I think it's really useful to have radiographs, like especially I also had an owner who was called out years ago who purchased a horse who was cleared as a vet pre-purchase exam, didn't have the stifles x-rayed because there was no obvious lameness. When I saw the horse, I was like, gosh, that horse moves weird behind. And I thought she was lame on a small circle at the walk, and she had a roach. And I said to the owner at the time, I'm concerned that when we start working with her, there could be something underlying that comes out. But anyway, she bought the horse because she was beautiful, lovely horse. After about 2 or 3 sessions, she was lame. And I was like, oh, this is what I was worried about. And anyway, we sent her off to get x-rays of the stifle, and this was one situation where the radiographs were really beneficial. And she had chips on both her stifles, on the femur. And I assumed she'd gone over something and hit them both, like something solid. And yeah, she was never sound to be ridden after that. The owner still owns her, and
Yeah.
she's really old now, and had a couple of foals from her, and she was a beautiful horse for her son. But yeah, so sometimes, especially when it's bilateral, it can be hidden. But the radiographs, if you've got radiographic changes in the stifle, you've probably got significant soft tissue changes. And so that's where radiographs can be very valuable. The horse that we dissected last week, we radiographed the stifle, and there was a lucency, like a dark area on the stifle. And then when we dissected it, there was like a crushing of the cartilage, and damage to the bone in that area. And we can see the lucency in the bone on the radiograph, but what you can't see is how damaged the cartilage was. So that was a really valuable exercise where we could actually see something on radiograph, and we correlated it to dissection. But if you're really investigating stifles, you want to do an ultrasound. And vets are increasing their skills in this area, which is great, because when I started out as a vet 20 years ago, stifles were not considered as a cause of lameness. And our radiograph machines have improved, in their ability to look at the stifle. But yeah, I guess we'd radiograph a hock and see changes, so we just didn't continue any further. But the ultrasound's really beneficial to ultrasound all the ligaments. So you can ultrasound the collaterals, the patellar ligaments, and there are some vets who can also image part of the cruciate ligaments, if they know how to do that. And you can also look at the meniscus. So I have a couple of horses that I'm treating at the moment who have had meniscal damage. It's often the inside one, the medial one. And, I would say those horses have had stifle instability. Like one of them we know had radiographic changes, and then has ended up with a meniscal injury. And I'm trying to think of my other one. Yeah, I have a couple of horses at the moment with different, with injector stifles, but you've got to be really careful injecting stifles because cortisone is not good for soft tissues. So I would definitely say if you're injecting them, please put hyaluronic acid in with it, and also consider how you're going to rehab that stifle, because that's the key there.
Absolutely. Yeah, definitely well worth investigating. And also, yeah, shout out to Heidi McGrath from Bramble Valley Proteotherapy, because she's so enthusiastic about doing those, radiographs, and then coming into the dissection. It was awesome. And yeah, if you follow Heidi, you might hear about future dissections in which there'll be an awesome way to look at the horse and understand more deeper with Raquel. So could be an awesome opportunity there if anyone's in the, south eastern corner of Australia.
Yeah,
For sure.
that's
Yeah.
for sure.
Yeah, definitely. So potential stifle pathologies.
Yeah, so obviously meniscus damage, which is one that I've mentioned, so that
Yeah.
the soft tissue structures specifically. I've treated a few horses with cruciate ligament damage, and there are specific tests that we can do to test the stability and the comfort of the cruciate ligaments. In dogs, we have a way of doing it where we have them laid down, but with the horse, we're doing it in weight bearing, but we test that motion of the tibia, and it's a specified test that I would only recommend a vet doing, just because if it's sore, and they could kick you. So cruciate ligaments do happen in horses, and it might be difficult to diagnose, but there is that specific test. Also, they can, and the medial aspect of the stifle is often more injured just due to the way that it's loaded. So I see a lot of flattening of that medial condyle under dissection. The other things we can get are developmental orthopedic disease, and osteochondritis dissecans, which affects the cartilage. It's common in young horses. It can be related to growth and nutrition, and loading, and so we want to be aware of that. I've also had a number of horses that have gone off and had OCD and had like screws put in and different things, so it's something to consider. And then you might get like fibular fractures. They're not as common, and you've got to be careful with fibular fractures because the fibula can be in two pieces anyway, and so you can get caught out saying it's a fracture, but it's just normal. So just being aware of that. And then obviously the last one is the growth plate damage, which which I mentioned, especially if young horses are working too hard, and twisting and turning on those stifles.
Absolutely.
And do you want to talk a bit about locking stifle? Because that's probably one that, I mean, if you've seen it,
Yep, definitely. So locking stifle, basically the patella gets stuck over that trochlear ridge. And so if you understand that it has to, in order for the stifle to flex, that patella has to come off. But and then we talked about there being that reciprocal apparatus. So basically the leg gets stuck in a whole limb extension. So that's locking stifle, and it's basically a compromised stay apparatus. The function just isn't going like cycling through locking and unlocking like it should. We mentioned at the very beginning there's a hereditary predisposition, so like minis with hip dysplasia. I've also seen a few horses couple that have had surgery, couple that haven't, with uh, they've had a change in the shape coming through that joint. And so it actually just, they just predisposed to having a really hard time with that patella locking on and off. So, in very extreme cases, there can be surgery, cutting ligaments there to allow it to unlock. But obviously, you'd always want to be doing your rehab before that, to see how much function you can have, because you don't want to be cutting ligaments and if you don't need to, because you're going to decrease the stability through that space. And especially you see it often, it's, if you've come forward with a genetic predisposition because of your conformation, then you're a young horse. So if you're going to cut that ligament at a young age, you recognize that your horse needs to live the rest of their life with that. And it's worthwhile exploring management, movement, variable terrains, feeding postures, rehab, activations, supportive therapies. Did you have a comment you wanted to add, Ben?
Yeah, also with cutting, I mean, they don't tend to cut it completely these days anymore. They often split it, but there has been shown to be increased amount of stifle arthritis. And, your horses are losing their efficiency to sleep. And so you're then just putting things under more load. And yeah, we'll talk a bit more about kind of rehab stuff in a second.
Yeah, definitely. So, yeah, and of course, we talked about the fact that it's a muscular influence that unlocks a stifle. So, if you have muscle weakness, that's going to be a potential cause or contributing factor. Poor muscle and ligament tone, but also lumbosacral, sacroiliac dysfunction, and trauma. So just as issues with the stifle will show up with roaching through that space because of all the connections coming up to the back, it can also work in the opposite direction. Having a compromised stay apparatus just in general. So, just other things that can be affected. You can have traumas to those muscles. You can have injuries, things that are going to affect it. Poor posture, another one. Definitely simple shifts throughout the front end of the body. And this is a big one that comes up through those myofascial lines. So poor posture, growing too fast. You can have, just the body can be a bit discombobulated, the muscle balance, the changes in alignment through the limb while they're growing. But also saddle fit is a really big one because, we've talked about muscle balance and all that, all those things that influence. So saddle fit, if you have poor saddle fit, you're always going to find disengagement behind. And when you find disengagement, you are not using the best form of, well, I suppose muscle balance. We've talked about the glutes, hamstrings, quads. They need to have their own healthy function. You disengage out behind, you're going to have a change in their activation, use, and development. And so, the stifle can lock due to that as well. And of
Yeah.
course, yeah.
Sorry, I just wanted to add because with the young horse thing, I've seen that a few times, and what's happening there is that the bones have grown, but the muscles maybe are too tight to allow for that bone growth. So it often happens when you've got a young horse in work, and so the bones are trying to grow, but the muscles are tighter because they're being worked. So I've seen it in standard breds. And so often those ones will resolve quite easily, like a couple of sessions, and they'll resolve because it's really just a matter of releasing the tight muscles to let the catch up with the bones. But yeah, I just wanted to kind of add to that.
Yeah.
Another thing is with the lumbar dysfunction is that we have to recognize that the nerves for like the quads specifically come from that lumbar area. And so if you've got a restriction within the lumbar vertebrae, or you can get weird anomalies in that lumbosacral area as well. Like we've seen hemivertebrae, which is like half a vertebrae. We've seen transitional ribs where they're half a lumbar and half a thoracic, and how that is going to change the output of those nerves too,
Yep.
as well as pelvic, positioning as well. So yeah, just thinking, well, the nerves for the function of the muscles that control that patella locking mechanism are coming from that lower back area.
Yeah. And, just acknowledging just how crazy some of that, those changes can be. Sharon May Davis says that, the lumbar has 6 vertebrae. Sometimes she finds 5. There's genuine anomalies coming through those spaces. So it's always worth considering. You can also just have clunking and slipping of the stifle. We talked about that before, the quality of it, but it's understanding that, we've described that muscles have different actions and they play different roles in that apparatus. So if you have a clunking and a slipping stifle where it's not locking, you need to be coming back and really utilizing a qualified body worker to help bring back function through those muscles that help the stifle to lock, and also working through the bony structures and just resetting the system, but working on posture and your quad balance again as well.
Yeah, you really need to look at that whole function of the back end when you've got a clunking and or slipping stifle. Like it'll often be, especially if you do like a tail rock side to side, that's when you'll see it happen. So if you like create a bit of like a push, you'll kind of hear it slip off. And the other thing, is once you've got function, so you've got to make sure you've got lumbar function, pelvic function, hip function, all the muscles surrounding are all happy, then you're going to have to build the strength to support it. So for some horses, it's a functional problem, like you've got restrictions in those areas. And for other horses, it's just a weakness, they haven't been utilizing their body biomechanically correct, and they just haven't built up the muscles, or they could be underweight and they don't have the muscles to just support keeping that patella in correct alignment.
Absolutely. So because we want you to feel empowered as owners, trainers, body workers, etc., Now that we've talked about all the things that influence or that you see when things aren't going well, talking about stifle rehab, so improving the space, what's your key things that pop up as being important through that journey?
Well, first of all, you do want to make sure you've got comfort and function. So, like I just said, then with your patella glide, your hip and stifle balance, the lumbosacropelvic function, patella tracking, that the reflexes are all kind of working to those supporting muscles, and that's where you need a qualified osteopath, chiropractor, are probably going to be your best bets in that situation, to really look at the structure, um, and to make sure that you've got that structural function. In terms of comfort too, like if there's an acute injury, you want to reduce pain and swelling. So, I generally use products like McDowell's Alleviate, to support them in that time, and also make sure that they're not doing crazies in the paddock. So, if they're going to do crazies, they're fine to be out in the paddock if they're not going to run and twist. But if they're going to run and twist, it makes it pretty challenging to rehab. And I've been working a cruciate horse that I've been working with well, I've known him for a long time, but he has a scar on the opposite back leg over the gaskin, which significantly affects the mechanics of that leg. He's a quarter horse, he's really upright, and he did a lot of work as a young horse. And yeah, like he's managed in the paddock, but he will often, keeping him strong enough and balanced enough is key, because when he runs around, then he's going to re-injure it. So
Yeah.
the comfort, the hoof balance, is really important, because if they've got a negative plantar axis, then that's going to put a lot of strain through the stifle ligament. So we really have to look at hoof balance to support the stifles. And sometimes if the horse is shod, we'll do specific shoeing to reduce the amount of rotation that's happening through the stifle, like to help give it more stability. Or, I've had others where we've raised the heel and put in a wedge to give it a more positive angle. So your hoof balance is going to be integral to optimizing that function. What else is
Absolutely.
important there?
Your core muscles, and quad function and activation, all for joint health through that space, and also just we've talked about the way that disengaging the hind end is a really big part of decreasing the stability through your stifles and changing the alignment through that space. And core strength is just an absolute foundation for having good stability through the rib cage that supports the lumbar, that supports the stifle and that groin area and the whole pelvis really. And you can also just imagine, we didn't talk deeply about these, but coming into the front of that flank area and up into the underside of the pelvis are all of your abdominal muscles too. So them having a good tone and good activation and good strength is important. So using your equiband appropriately, building up, and also doing all of your activations. So that means, that often means rocking the horse from side to side and being able to see, does my horse's quadriceps turn on? And if they aren't, having exercises that include raking, tapping, bringing awareness to them, like little pinching to say, hey, you guys need to turn on, and come to the party basically, and then practice. Hey, turn on, turn on, turn on. So just as a successful note, we've been talking in the online functional posture course. Once you have your few exercises and you realize what works for your horse, you only 3 days a week is so successful. So I have a bodywork client and her horse, this is 28. Is 28. We both turned 28 this month. How fun is that? We had this moment. She was like, she's 28. And I was like, I just turned 28. Anyway, so this beautiful older horse who actually does have quite a nice body, has had a peroneus tertius injury. She's coming back. Her stifles went a bit clunky. She has done activations 3 times a week, just a handful of them, no more clunkiness. And that's in the space of 3 weeks. So activations, super important. And of course, your diet. So you mentioned helping the joint, so using Alleviate. There's also IVHA, which can be very useful.
So
You've got,
HA is hyaluronic acid.
yep,
Yeah.
sorry, yep, hyaluronic acid, muscle excel or hemp protein, other forms of joint supplements like Rose Hip Vital, etc. So there's a lot there for you to support them. And now, talking about supportive approaches, I know we've just said bodywork like 10 times, but it is very important. It's very useful. Regular bodywork throughout this time is like crucial. Of course, having taping, kinesio taping can be very useful. That biceps femoris action, the quadriceps, all of that space, but also through the lumbar when you're bringing in comfort can be very powerful. Did you have any other comments about taping with all your taping qualifications?
No, but I used it, well, yes, I used it a lot with especially locking stifle and varying the type of taping that you're doing so you're getting proprioceptive input. So, and then using it to create support and challenges through there. Probably the last thing that I want to leave with in terms of takeaways is that cutting the ligament is like your last final extreme option, even splitting it, like any surgery on it. All the ones that I've managed, we've never had to cut it. We've always been able to manage it through rehab. And, obviously the longer they've been locking, the harder it is. But, supporting strong stifles and recognizing weakness there early is really beneficial. And yeah, your activations are an absolute key. And, I've rehabbed a few. I didn't really know about activations back then when we were doing those. So we did it all through a lot through movement and hoof balance and things. But, you can create a great improvement in stifle stability through an appropriate rehabilitation program.
Absolutely. Yeah. So I really hope this is a useful episode for everybody. Overall, it's not just a stifle issue, it's a whole body issue, and comfort, function, activations. You have so much power in your hands to make a big difference to your horse's stifles.
Yep, definitely. So thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights.
And we'll see you in the next exciting episode.